Health officials in Kansas are sounding the alarm amid an outbreak of tuberculosis in that state. 2 people have died. 67 people are known to be infected. Experts say that the scope of this outbreak could be larger as officials continue to identify more patients. Tuberculosis is one of the world's leading infectious disease killers, according to the CDC, and it spreads person to person through germs that can stay in the air for several hours. So for more on this outbreak, I want to bring in Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, how concerned are you about this outbreak?
I'm concerned for the people of Kansas and the ability to get a handle on an outbreak that's been going on since last year. I don't think that this poses a major risk to the general population. I think that this is probably something that is somewhat contained, and since it's been going on for some time, that Kansas public health officials probably have some idea of how it's spreading. That hasn't been released publicly, but I think it's not something that every person has to worry about, but certainly tuberculosis has never went away.
So it never went away, and I guess it remains one of the biggest infectious disease killers in the world, if not the #1. And it causes over 1 million deaths a year. Is that true? Is that how worried should people be, and what advice would you give to people?
If you're talking about from a global health perspective, tuberculosis is the biggest infectious disease threat that we face. Over 1 billion people are infected with this bacteria, and over 1 million people die. It is the #1 infectious disease killer, as you said. In the United States, we have around a little bit less than 10,000 cases a year. So it is well controlled in the United States. Maybe about 500 or so people die every year in the United States. So it's not a major public health threat in the United States, but that doesn't mean it couldn't be, because as you've said, this spreads through the air. So it is very contagious. We don't vaccinate people against tuberculosis, and it is something that's very cumbersome to treat. It's not something that's just a simple course of antibiotics. It's several different drugs. So it is something that we in the infectious disease community have pay major attention to. But in the US, it's not likely to become a major public health problem outside of these kind of outbreaks that occur in enclosed populations. We've seen that happen in prisons. We've seen that happen during the 1980s and 1990s amongst the HIV population in New York City. But it's not something that generally spreads very well in the population. And not everybody that gets exposed is going to get active tuberculosis. Only about 10% of those individuals get it. 90% go on to what's called latent tuberculosis, which is much easier to treat.
Yeah, it's something you don't want to get in general, though. So let's hope we get on top of this. Dr. Amesh Adalja, thank you very much for joining us and informing us about that. Appreciate it.
Thanks.